This is Dr. Deuk. I'm here with one of my patients who underwent the Deuk laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there, and then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. It just took a long time to recover from that. So this was much, much better.
Your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and it, most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C3-4, which was, you can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yeah. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Deuk and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations.
I think the laser is the best thing out there to help with this type of surgery. It's all legit. That's all I can say about it.
Dr. Deuk here at the Deuk Spine Institute. I'm with one of my patients who's traveled to us from Mississippi, and he came here for the Deuk laser disc repair to be done for a herniated disc on his neck, and he's now here today, just one day after surgery. How are you feeling today?
Feeling great. Feel like the weight of the world been lifted off my shoulders. Feels a lot less pain in my shoulder, no more tingling. Feels like my body's trying to recover back to normal. I think the surgery went very well, no problem whatsoever.
And you're just one day after surgery. Can you tell whether the neck pain is gone yet?
The neck pain is gone, and the pain throughout my shoulder, the tingling, everything is gone. A little soreness in my throat. My voice is a little harsh, but other than that, I feel great.
Awesome. Can you show us your incision? Oh wow, look at that. So you have a 4mm incision. You can see that right here on the surgical footage of the endoscope. We actually, when you watch the video, you can see all the herniated discs back there. We were pulling them out one at a time. You had about 20 pieces. And then you can see the nerve root right there in the foramen. And there's no herniated discs anymore on the nerve root. We got them all out of there. I had to open up the posterior longitudinal ligament and get all those fragments of disc herniation out of the epidural space that were pushing on your nerve. And I got a good look at everything and it looked fantastic. So I think you're gonna do great. Did you consider having like a fusion surgery? Did anyone offer you fusion before?
Yes, I was offered fusion. I was told that was the only surgery that could be done. I started Googling. I come across the laser surgery and I decided to give it a try. And I don't regret it. I think it was the best decision I ever made for my age, and I think the outcome would be a lot more better in the future. And it was a great experience. It really was.
And you work with metal as your job, so you didn't want metal in your neck, on your spine.
No, I think the cold weather would have had an effect on it. I think it would have caused a adjacent effect, is what they call it. When you do the fusion, it make the disc below it or above it wear out. And I'm 34 years old, and if I live another 30 years, I just feel like it would cause significant problems. I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
Imagine, and hopefully you can hear me. We're going to verify that. But we have just completed an anterior cervical, because it's the cervical spine, Deuk laser disc repair. What does all that mean? So complicated, these terms. Folks, the most common cause of back pain in the world, the most common cause of neck pain in the world is something called a herniated disc. And what does that mean? Well, let's take a look at this disc and I'll show you what I mean, okay? So the disc is a cushion. It's like a meniscus in the knee. It's soft, kind of cartilaginous, but it's got a somewhat of a jelly center, and then it's got a wall that holds the jelly in. Well, when you get a tear in the wall, like you see right here, the jelly from the center can push out, kind of like taking the cap off toothpaste, squeezing the toothpaste, pushing the toothpaste out. As long as the cap's there, you're not pushing any toothpaste out because you got the whole wall around the toothpaste container. But once you make a path of least resistance that allows the jelly or toothpaste of the spine to come out, then you get a little bit stuck out there. And what happens is this creates inflammation. And Deuk Spine Institute and myself, I pioneered the understanding of neck pain from a herniated disc as well as back pain. It comes from inflammation within the wall of the posterior annulus, okay? And what we're doing here is we're going in with a tiny little tube that's just 4 millimeters wide, getting to the back of that tear and cleaning the tear with a laser, removing the pieces of herniation, getting rid of the herniated disc back here that's pushing on the spinal cord and nerves. And when we're done, there's a defect in the wall which over time will mend itself. And it mends itself with something called collagen. Collagen is how your body heals itself. And all your tissues heal with collagen, okay? And most tissues are not made up of collagen. They'll have a little bit in it, but most of the tissues like your liver, your kidneys, they're made up of specialized cells that are used to filter the blood system and clean out the toxins, okay? But in the disc, the wall of the disc is made out of collagen, and so it's replaced with collagen and repaired with collagen. So it's a perfect repair. And that's why we call it the Deuk laser disc repair, because the disc can repair itself after we go in with the laser and clean the tear and clean out the herniation. That's what we did on this patient. I tried to get 3 discs, but the bottom disc was C7-T1, long shot in most patients. This patient had a thick neck, high collarbone, really broad shoulders, very muscular guy, and I just couldn't get down to C6-7. As a matter of fact, I could barely get I couldn't get down to C7-T1. I could barely get C6-7. We did C5-C6, no problem. So we were able to repair 2 out of 3 discs. Probably 1 out of 100 patients I'm not able to get to one of the discs that I'm trying to get to for whatever anatomical constraint there is. Now, that said, I think he's going to do fantastic. I think he'll be very happy with the results, and here's why. The C7-T1 disc that I couldn't get to, It's the least effective of all three, and more importantly, it's so deep in the neck and the chest cavity that there's really no movement going on there. And that was proven today during the surgery as we were pulling on the neck, manipulating him, trying to get access to it. I was able to see in the operating room that that bottom disc was not really a problem. So I think we'll get rid of 90% plus of his neck problems. Are we still live?
Yes.
All
yes,
right.
We're still going.
So apologize about the sound. We are not able to hear me talk to you during the surgery. We've got a broken soundboard and we've been trying to replace it and repair it unsuccessfully. As everyone knows, there's a huge shortage of chips and electronic components related to chips. So if somebody out there has the right kind of electronic component that we can use for our system, I don't really know what it is. It's some kind of a soundboard, but
I think it's an audio output, but
I'm not that technical with the equipment, but that said, I apologize. It'll be a little while before we get my speaker working in the operating room, but at least you could watch the surgery and you can hear me now. So we have questions. Well, our first question is from Reiko Pilot.
yes, from Reiko Pilot.
He's a repeat customer on our broadcast. Thanks for watching, Reiko Pilot. We enjoy having you and your questions.
And Reiko Pilot's question was, what does recovery look like from a Dldr surgery, and how does that compare to an Acdf?
Great question. So Reiko Pilot's asking, you know, Dr. Deuk, a lot of people get Acdf or anterior cervical discectomy infusion. That's where we go in and clean out the disc and put a metal plate in. What's the recovery like with the Deuk laser disc repair, what we just did, versus more traditional old-fashioned Acdf surgery with metal? The recovery with the Deuk laser disc repair is immediate. It's 1 hour recovery and you're done. You go home, you can go back to work literally that night or the next day. You just can't drive a car for the first day. Now, with the Deuk laser disc repair, there's no need for narcotic painkillers. We're not drilling, and we're not removing, you know, natural structures and creating a lot of scar tissue and trauma to your tissues in your neck. That happens with the Acdf. And because it happens with the Acdf, remember the Acdf is that fusion surgery, okay, where we bolt the plate with screws to the spine and put a cage in. That Acdf is extremely traumatic to your soft tissues, to your spine. It creates a lot of pain for weeks and weeks after surgery. People don't go back to work after an Acdf usually for at least a few months. With the laser surgery you just watched, this patient could go back to work in a day. Now, he works construction management, I know that. He's a bodybuilder. He's got a great physique. He wants to hit the gym. He wants to get back to work. He's chomping at the bit to get back to work. I want him to be able to go back to work, and he'll go back to work tomorrow if he wants to. But he cannot lift anything over 25 pounds. Now, with an Acdf, the fusion, people are out of work for at least 6 weeks to 3 months from that surgery. Whereas with the Deuk laser disc repair, 1 day. Great question. Recovery is very quick with the Deuk laser disc repair compared to Acdf. Any other questions?
That'll be it. Yeah, that's it.
All right, folks, we just finished this surgery. We've got another one coming up in about 30 minutes. So the next one is going to be a Deuk laser disc repair, anterior cervical again. We're fixing one herniated disc in this patient. This patient is a pilot. He works for the U.S. Air Force. He actually used to refill jets in the air at 30,000 feet. He was the guy flying the aircraft that has the fuel that they do the in-flight refueling for jet pilots. So he's now retired, and he's coming to us from Seattle, Washington, and basically will be our next surgery. He's a single level. I can tell you this right now, he's got a nice thin neck, and he's going to be relatively easy access. Very different than what you just watched with this surgery. This surgery on a scale of 1 to 10 that we just did was a 10 out of 10. It is tough to get in there. We had so many issues. We had a thick muscular neck. We had a short neck, high clavicle, deep spine, really far back. Very hard for me to feel with the muscles. And then he had bone spurs in the front of the spine that made it difficult to get in. But we got 2 out of the 3 discs done, and I think he's going to get 90% pain relief or higher. I feel really optimistic. But the next patient is a C5-C6 disc herniation. He didn't want fusion. He didn't want metal in his neck. He wanted to be fixed and fixed right. And so he chose endoscopic surgery here at Deuk Spine Institute. And once again, he's a retired Air Force. Okay, jet pilot. All right, we'll see you soon. And get your questions ready for the next surgery. We probably won't have audio again, but we'll take your typewritten questions. You can type them up in the dialog box on Facebook and YouTube and Twitter and LinkedIn. So look forward